L. Swasticharan, who's additional DDG, Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India, to speak about and bring us up to date. And as we have heard about Code of Conduct, we would like to hear more about it. So how we came to the Code of Conduct and what it is now and what does it say. So over to you, Dr. Swasticharan.
Thank you, Monica. I think Upendra has done a good job of explaining several tobacco industry interference that happens across all sectors of tobacco control. And when I was practically, you know, when I started working in tobacco control in 2013-14, we used to do a lot of activities, and Article 5.3 or the tobacco industry interference, now, to have a code of conduct for ourselves, we used to think that, you know, what is this? We are studying something which is obvious. Not like we don't interact with the industry, we don't have any interaction with the industry. So Article 5.3 and the code of conduct, you know, we are having another document which says, you know, that we should not do it, which we are not doing anyway. Like that. And then later on, through the years, then most probably during those years when we had the challenges with the electronic nicotine delivery system, and then the formation of the Foundation for the Smoke-Free World, then we started, you know, realizing that the tobacco industry is not as innocent as we think, and we need to guard ourselves or all those people who are doing tobacco control against the interference of tobacco industry. We also have good evidences from many of the scientific studies that if you want to implement all the articles successfully of all the articles of WHO FCTC article, if you want to do it successfully, you have to have a strong 5.3 implementation. So that was how I think probably many of the serious thinkings in the ministry started, and then because of also many of the representations from the civil society, then we realized that, oh, this is something which we need and which we wanted to do as a country. So the code of conduct for the public health, public officers to comply with the WHO FCTC Article 5.3 came up on 4th of July 2020. So this was to start with concerning only with those people who are working in the Ministry of Health, in the Directorate office, and also those associations, those organizations which are related or under the Ministry of Health. So we circulated that on 4th of July, and when we were circulating it, we made it sure that, you know, WHO FCTC had issued guidelines for the compliance of this article. Then now this ministry has developed this code of conduct, which includes a comprehensive protocol to deal with any interaction with the tobacco industry or its representatives. And this code was also to apply to all the officials of the Ministry of Health and Family Welfare Organization, Family Welfare, its department, and all the autonomous institutes and offices under the jurisdiction, and to any person acting on their behalf. So we made it clear that what is this code of conduct, for whom it is meant for. Then we also explained to them what are the main features of the code of the conduct. Now, we said that interactions, if any, with the tobacco industry shall be conducted transparently as per the guidelines annexed with the code of conduct. So transparency was brought out, and then we say that no person shall directly or indirectly accept, support, or endorse any partnership with and contribution from the tobacco industry. And in case there was an existing partnership agreement or collaboration with the tobacco industry, it should be discontinued within 30 days of circulation of this code of conduct. Then officials were also to ensure that no persons employed in the tobacco industry or any entity working to further its interests and no person shall accept payments, gifts, or services, monetary or in kind, from the tobacco industry. Then we also came up with what is to be done if any violation is noticed, and the same violation by any official can be reported to the Director of Tobacco Control. So the code of conduct came up this way, and in that particular code of conduct, we tried to explain for all those people who are working in this organization, who may not be directly working with tobacco control as a tobacco control person like us, but they need to know it from all angles. So we give them a background about why tobacco is the leading cause of death and why it is responsible for the various morbidities, and also why it is a developmental issue. And then we also draw the attention that India is one of those few countries who signed very early and ratified the WFCTC. And under that ratification, we as a country is obliged to implement all its articles, including 5.3. So this is in an attempt to sensitize everybody working in the ministry about Article 5.3, why we have come up with this code of conduct. And then we carry on to explain the purpose of the guidelines, which is to protect the tobacco control policies and program from the commercial and the vested interests of the tobacco industry. And we also explain the scope of the code of conduct, which I've already done. And we also tell them various important definitions like who is tobacco industry, we made sure that the definition is large enough to cover all the aspects and all the aspects of tobacco industry and what actually constitutes tobacco industry interference. And we then carry on describing what are the possible interactions with the tobacco industry. So we tell them how it is to be done, if at all it is required. We should interact with the tobacco industry only when it is extremely necessary. Then if you have to interact with them, you have to observe some guidelines. So, and that guidelines was also annexed with a code of conduct that we circulated. Then we carried on explaining the partnership and the contribution aspect of the code of conduct. And we tell them that any potential or real partnership and non-binding or non-enforceable agreements, as well as voluntary arrangements with the tobacco industries or any entity or front groups or persons working to further its interest, was also seen as a part of partnership. So many, as Upendra said, the industry would come up with funds with front groups like farmer organization or traders organizations or even retailers organizations like that. Then the tobacco industry organizing, promoting, participating in or performing youth public education or any initiative that are directly or indirectly related to tobacco control, or their logo or brand name and trademark was also included in the partnership. And any position paper or policy instrument drafted by or in collaboration with the tobacco industry or any organization acting as a front group of TI was also included in the definition of partnership and contribution. So what I mean to say is that by drafting the code of conduct, we try to take care of all the possible tobacco industry interference that had been happening and that could happen in future, taking best practices from across the world. And we carried on to explain that the conflict of interest as well, that the officials shall ensure that no person employed by the tobacco industry or entity to further its interest, as I said, and the department should not award any contract or carry out any work related to setting or implementing public health policies with respect to tobacco control to candidates or tenderers who have conflict of interest with established tobacco control policies. So we were trying to guard all our policies and tasks related to the Ministry of Health with people who may be associated directly or indirectly with the tobacco control. So that's how we have done that. And now sometimes if we issue a code of conduct like this, we assume that once it is issued, everybody reads it and then implements it. But however, in real life, it doesn't happen like that. So our Joint Secretary, Mr. Vikasil, is also suggesting to us that we should have regular webinars because of our COVID times to, sensitize them again and again, about the code of conduct and what we should be doing with this code of conduct. So we have started, as they say, the charity starts at home. So we have started from the Ministry of Health, and I hope in future it gradually extends to all other related departments. And this is, as of now, what I have to share with you. Thank you, and over to you.
Thank you so much, Dr. Swasticharan.